In our daily routine practice, we came across a common question that why do some patients brush twice daily but still end up with dental caries? And more importantly, is caries really a permanent disease? Can we actually reverse it? So in today's lecture, I am going to simplify the entire concept of caries from its cause to progression in a way that will actually make clinical sense. So very first introduction, how will you define dental caries? Dental caries can be defined as a preventable chronic biofilm mediated disease modulated by diet. Means it is a preventable biofilm mediated disease which is strongly influenced by diet. It is multifactorial that involves bacteria, diet, time. It is characterized by demineralization of inorganic portion and destruction of organic contents. So it's let's first understand how caries actually starts. Now in top of the picture, there are three pictures at the top of the lecture. One is showing normal tooth, second one is showing initiation of dental caries, and then leading towards cavity. So very first we discuss how caries actually starts. So there are four basic steps behind the initiation of dental caries. Very first step is fermentation of carbohydrate to organic acid. This process begins when bacteria in dental plaque metabolize uh, carbohydrate like sugars and produce acids. Bacteria undergo fermentation to drive energy from sugar, and in that process the end product are acid production like lactic acid. Once acid form, these acids lowers the pH in the mouth. So very first fermentation of carbohydrate, second step is acid production. Now these acids lowers the pH in the mouth. Now here is the important part. When the pH drops below a critical level, now critical level is around 5.5. Below this pH, enamel start to dissolve. This is called as demineralization. But this is not a one-way process. When pH returns to normal, saliva helps to redeposit minerals back into the tooth, and this is known as remineralization. When pH returns to normal, in which conditions? When carbohydrate is no longer available. So in that conditions, redeposition of minerals into the tooth occurs, and that is known as remineralization. So essentially your tooth is constantly going through cycle of demineralization and remineralization. Now in this picture, that is known as caries balance. So your tooth is constantly going through a cycle of demineralization and remineralization. There is equilibrium between these two processes and they are reversible. Dental caries progresses only when the balance between demineralization and remineralization disrupt. How it disrupt? Very first discussed factors that maintains equilibrium between demineralization and remineralization. Demineralization is controlled by factor known as pathological factors. That includes acid producing bacteria, subnormal saliva flow, frequent drinking of fermentable carbohydrate, poor oral hygiene. And remineralization is controlled by factors known as protective factors. That includes saliva flow in its components, remineralization through fluoride, calcium phosphate, good oral hygiene, strategies that maintain a healthy microbiome that includes probiotics, pH modifiers, use of xylitol. So caries develops only when demineralization exceeds remineralization over time. Due to means when pathological factors predominate protective factor, then it disturb this balance. So caries develops only when demineralization exceeds remineralization over time. That's the key concept. Now Uh, Now let's break down the main factors responsible for caries, or we can say what are the factors that influence the caries process. There are five. Dental caries is a disease that is dependent on the complex interrelationship between following factors. Very first, biofilm. Biofilm, formerly known as dental plaque, which is formed on the tooth and readily apparent if tooth brushing is stopped for 2 to 3 days. Previously, uh, it was known that plaque does consist of food debris, but now it is established that biofilm base is composed of microorganisms. 70% of biofilm is comprised on microorganisms. So when plaque is young, now plaque formation occurs in different stages. First stage of plaque formation includes the formation of pellicle. Pellicle, that is unmineralized layer of plaque that lacks any mineralized component. So it matures through passing different stages. Once the plaque matures, it leads to the uh, it leads to the formation of different colonies. Like in initial stage, Streptococcus mutant is involved. When plaque is young, cocci predominate. But as plaque ages, the proportion of filamentous organisms and valinola increases. So which factor influence the composition of biofilm? That is diet. How? Because diet is utilized by bacteria and they in turn produce acids as a byproduct that lower down pH. So Streptococcus mutant is involved in caries lesion formation from its initiation, while lactobacilli flourish in a carious environment contributes to caries progression. Second factor is diet. Diet plays again a crucial role. It has already been discussed during its pathogenesis. But if we want to prescribe any dietary advice in case of high caries risk patient, it is based on three factors. Very first, drop in pH lasts for approximately 30 minutes. Second, frequency of sugar intake is more important. And third, thickness of food is very important factor in the cariogenicity. This is why frequent snacking is more harmful than eating large amount at once. So third factor is teeth. Again, teeth consist of calcium phosphate that leaks out of the cell when environmental pH lowers. It marks the beginning of demineralization. And when pH recovers, that calcium and phosphate can reprecipitate on remaining mineral crystals. This is remineralization. And second, if we compare enamel and dentine in terms of caries, then dentine is more vulnerable than enamel because of its structural differences and greater number of impurities in the crystal lattice which facilitated its degradation in acidic environment. Demineralization that occurs first is associated with enamel and destruction of organic component. It means caries involving dentine that leads to cavitation. Common habitat favorable for harboring pathogenic biofilm includes pits and fissure, that is a commonest site, root surfaces, smooth enamel surfaces, subgingival areas. Now fourth factor is time. Caries requires time to develop. It is clear that caries lesion do not develop overnight but takes time. In fact, it may take years for a caries lesion to develop a distinct discontinuity or break its surface integrity, otherwise called as cavitation. This is also means early lesions can be reversed if managed properly. Now fifth, saliva. Saliva is a natural defense mechanism. Now what are the salivary mechanisms that maintain normal oral flora and tooth integrity? Saliva maintain normal oral flora and tooth integrity through four basic mechanisms. Bacterial clearance. Adult produce daily 1 to 1.5 liter of saliva a day. What it will do? It virtually remove all microorganisms adherent to oral surfaces. And this flushing effect is most effective during mastication. Second, direct antibacterial activity. Now, saliva exerts a direct antibacterial activity through two components: salivary enzymes, non-enzyme proteins. Salivary enzymes include amylase, lactoperoxidase, lysozyme, and lipase. Amylase, what did it do? It increased the availability of oligosaccharide, that is less cariogenic. Lactoperoxide, what it will do? It suppresses plaque formation on tooth surfaces. Lysozyme, again lethal to many organisms, and it suppresses plaque formation. It activates complement system that leads to bacterial death. Lipase, it hydrolyzes triglycerides to free fatty acids, and free fatty acids inhibit bacterial attachment. Non-enzyme proteins include lactoferrin that uh, ties up free iron. In this way, it inhibits growth of bacteria. Immunoglobulin A, glycoproteins, they causes agglutination of bacteria. Now, third, buffer capacity. Buffer capacity of saliva is determined by primary buffer, includes bicarbonate ion concentration. The benefit of buffering is to reduce the potential for acid formation through maintaining pH. Remineralization. Again, saliva plays very important role. How it plays very important role? Because saliva is saturated with calcium and phosphate. Once the pH restores to normal, it leads to the redeposition of those ions into the enamel crystals. So in this way, uh, it plays important role in remineralization. Second, what do you mean by Stephen curve, and what is the role in understanding and progression of caries process? Robert Stephen measured plaque pH against time using electrode. The resultant graph is therefore known as Stephen curve. This is Stephen curve. He plotted pH against time. What is the significance of this curve? What is the significance of this curve? Now suppose, look at this graph. This is a normal pH from 6.0 to 7.0. For example, if a patient consumes any sugary drink that is rich in carbohydrate, so what will it have? What will leads to? It leads to the drop of pH from 6.0 to 5.0. Now this drop in pH will remain up to 40 minutes. Means from this pH to if patient consumes, maintain oral hygiene, then pH will restore to its normal value within 40 minutes. And if within 40 minutes he doesn't maintain oral hygiene and consume frequent consumption of any sugary drink, then it falls below 5.5. Once the pH falls below 5.5, it leads to cavitation. That's the core concept of this curve. So to summarize, we can say that caries is a dynamic process. It involves demineralization and remineralization. It depends on biofilm, diet, tooth, time, saliva, and most importantly, it is preventable and reversible in early stages. That will be discussed later on.